Today I'm here with Dr. Todd Bell from Texas Tech University, and he's going to answer some questions that we have about the COVID vaccine. Dr. Bell, we know our population has a lot of questions about this COVID-19 vaccine. Can you tell us why they should be getting vaccinated?
Absolutely. So the vaccines that are approved in the United States have really just been home runs from the standpoint of being able to prevent people from getting sick. We know that there are some people who just have risk factors that if they get COVID, they're going to be at much greater risk of having bad outcomes or even death. And the vaccines are able to reduce those bad outcomes by 90% or more in the studies that have been done. So these are really, really great vaccines. And hands down, that's the reason people need to get it, is to be able to protect themselves. Now, as an added bonus, we know that people who are not sick are less likely to be able to spread the virus. So we also want folks, even who are not at risk of having complications from the virus, we want them to actually get the vaccine too when it's available to them, because if we're all in this together and we can get everybody protected, then we can start looking at things like getting rid of these masks.
What about people who've already had COVID-19? Should they continue to be vaccinated?
They should. So we know that people who have been infected with the actual virus, we know that they probably have some immunity that lasts for some period of time. And it looks like for the average person who's had the virus that they're probably good for up to about 5 months. Now the problem, of course, is that 5 months later, we don't know. Are they actually going to then be susceptible? We certainly know that some people are, and we've had quite a few cases around the world of people getting infected and then getting better, and then a few months later getting infected again. We know that folks who have been infected are going to have at some point in the future, they're going to potentially become susceptible to get infected again. The vaccine, because it focuses the immune response just on the important parts of the virus, is able to give us a longer duration of immunity. So instead of the 5 months that we think the average person is going to be immune after getting the virus, we think that folks who have had the vaccine are going to be immune for a year or maybe even 2 years.
What about adverse reactions? Have you seen anyone who's had a major reaction after getting the vaccine?
Sure. So the things that we've seen for the most part have been those typical things that we would expect with the vaccine. And these are things that happen when the immune system is being triggered to practice a response. So we see that people get muscle aches, they may get a low-grade fever, they may have a headache. Those are all part of that immune response to the vaccine, just like they would have the immune response to the virus. Now the good news is that those types of reactions are typically short-lived with the vaccine. They usually last 24 hours or less. They're usually a little more with the second dose of the vaccine than they are with the first dose of the vaccine, because the immune system is already primed. There's been one patient that I'm aware of that I was involved in taking care of that we had to give them some Benadryl. Beyond that, we haven't had any issues, at least with those vaccines that I've been involved with. Now we know that around the world and around even the country, there have definitely been some people who've had an allergic reaction. So if people have had a severe allergic reaction, they had to get epinephrine, they had trouble breathing, then those folks are people who shouldn't get the second dose of the same vaccine. They should talk with their doctor about getting the second dose. That's also the reason that after we give the vaccine, we have folks wait for 15 minutes, because we want to make sure that they're not going to have an allergic reaction to the vaccine, just like someone who's allergic to eggs could have an allergic reaction to a baked cake.
We know that people are a little concerned about this vaccination because it's come out so quickly. Is there any reason that someone should not get the vaccine or anything they should be worried about?
Yeah, so people do have some concerns about that. Now, let me kind of lay it out a little bit. So we can, when we're making a vaccine, we have to either make it expensive, we got to take a long time to do it, or we have to sacrifice the efficacy, how effective it is. And in this particular situation, what we've done is we've sacrificed money. We've spent a lot of money being able to do different parts of the studies in parallel instead of doing them completely sequentially. Now what that's allowed us to do is to be able to shorten the timeline for vaccine development without sacrificing the safety or without sacrificing the efficacy of the vaccine, but it's cost us a lot of money to do it. Now, the good news is the end result is something that really is a great and very effective vaccine, but it wasn't cheap.
So for someone who has chosen to receive the first and second vaccine, do they still have to wear masks and social distance?
They do. Now, here's where it gets a little bit weird. There's a couple of reasons that people who, even after they've been vaccinated, shouldn't go to lick a bunch of elevator door buttons. And first of all, because licking elevator buttons is gross, right? So the second reason, though, is that the vaccine, even though it's more than 90% effective, it's not 100% effective. There's always the chance that someone could be that one person in 20 who still gets infected even if they've been vaccinated. Now, it turns out that their infection is going to be milder than if they had not been vaccinated, but we still don't want them to get sick. The third reason is that even though we think that the vaccine decreases the risk of asymptomatic viral shedding, viral transmission, we don't have proof of that. Just like people can get the actual virus, not have any symptoms, and still be able to spread the virus. We know the vaccine prevents people from getting sick with the virus, but we don't have the proof yet that the vaccine prevents that asymptomatic shedding. So until we have that kind of science that's been done, until those studies that are done, and they're ongoing right now, that's yet another reason that we still need to wear the masks, we still need to do the social distancing until we either have everybody or the majority of people vaccinated, or we start getting some of that science and research saying, hey, you know what, this is also going to decrease the risk of inadvertently spreading the disease even though you may not feel sick. So sometimes people will ask me whether they really need to get the second dose of the vaccine, and especially if they've already had COVID before. And then they get the vaccine later and they're like, well, hey, now I'm double protected. Do I really need that second dose? I think that it's kind of like a really great cookie recipe. You know that if you follow the recipe, you're going to end up with really great cookies. If you start messing with the recipe, they may still be great cookies. They may not be great cookies. You don't know. So when we look at the vaccines, we're obligated to try to follow the recipe. That is, what was actually studied? How are they designed? And what do we know is going to be the outcome? We know that if we follow and we do one dose, and then after a certain number of weeks, 3 weeks or 4 weeks, depending on the vaccine, we get our second dose, we know we're going to have some really great cookies. We know we're going to have more than a 90% efficacy. If we start messing around with that, we just don't have as good a data to know how protective it's going to be. So, highly encourage people get your first dose, go ahead and get your second dose.
Thank you for joining us today, Dr. Bell. We appreciate your information. For more information on the COVID-19 vaccine or information about the Park Central campus, give us a call. We would love to help you live your best life.